My name is Megan Dwyer. I am a nurse practitioner at Chaz Health. A nurse practitioner is someone that operates with a nursing degree and goes on to get additional education, either a master's or a doctorate in nursing typically, and they are then able to independently care for patients, including evaluating them, diagnosing them, and treating them for medical conditions. I wanted to take more of an independent focus on my career, and I really wanted to be able to educate patients, which you don't get much of a chance to do as a registered nurse. I chose to work at Chaz Health in their nurse residency program. It was the first year we started the program, and what the program basically does is provides new graduate nurse practitioners additional training so that they feel more confident to do their job. They are all licensed and able to practice independently, but they have chosen to get additional on-the-job training to further their skill set and confidence when caring for patients. I love to see patients come back after I've seen them for the first time and to hear how they're doing since I last saw them, to see that I've made an impact or what I can do to further help them. It's really nice to see the fruits of your labor and to be able to see how my care has impacted their health one way or the other. And if things aren't working so well, to say, well, what can we do together to have a positive outcome? Some of the extra steps it takes to be a nurse practitioner is having to go back to school to either get a master's or a doctorate, and then having to take a national certification test to certify yourself as a practitioner. And you also, depending on where you work, can also get a DEA license in order to independently prescribe controlled substances. You'll always have a job as a nurse practitioner, no matter where you end up. And it's a very flexible position in that you can choose your schedule a lot of the times. You can choose where you want to live a lot of the time. And you can choose a schedule that works for you and for your family. So a typical day for me at Chaz Health would include coming in the morning and looking at my schedule for the day, looking to see what type of patients I'll have throughout the day, if there's anything I need to be overly concerned about, if a patient has just been in the hospital and they're coming to see me after having been in the hospital, if there's any procedures scheduled for the day, we look to see if we have the equipment necessary for the procedure, what do we need to do for setup for that. And we also make sure that our inboxes, as we call them, are addressed, which includes patients' lab values and concerns, and they can communicate with us through a portal, which is amazing technology that allows them to have individualized communication with their provider one-on-one via email. We have subsidization from the government, allowing us to care for all people, regardless of your ability to pay. And I'm so thankful that I'm able to care for minority populations and populations with socioeconomic disadvantage that might not otherwise be able to seek health care. So it's been very rewarding. When going to see each patient, I prepare before I go in to even see them. I look at each patient's chart before I go into the room. I look at their diagnoses, their most recent visit, their current lab results, see if anything needs to be addressed at that visit that they didn't mention or wasn't brought up when the MA went to see them and get their vital signs and ask them why they were here. Then when I go in to see the patient, my assessment of the patient starts at the door. As soon as I walk into the room, are they sick or not sick? Are they in distress? Are they doing okay? And I take those mental notes before I even start speaking with the patient. And then when I start speaking with the patient, I ask them what brought them in today and what can I do to address their concerns. If there are any concerning vital signs, I would address those at that point as well. And then I would follow up with my exam.